Hi y'all, I'm Karen.
I'm Kay.
I'm Allison.
And thank y'all for coming. We're here today to go over a transcutaneous bilirubin check after discharge. And our objectives for the day, and if you want to follow along with your PowerPoint, is to identify the reason that we do non-invasive bilirubin checks, to identify newborns who need to return after discharge for a non-invasive bilirubin check, to identify procedures for ordering newborn to return for non-invasive bilirubin check after discharge, to identify the process of performing non-invasive bilirubin check on infant after initial discharge, and to identify the procedure for documenting non-invasive bilirubin checks performed after newborn discharge. And our agenda for the day on the next page is discuss the reason we do non-invasive Billy checks, discuss newborns who need to return after discharge for a non-invasive Billy check, discuss the procedure for ordering newborn to return for a non-invasive bilirubin check after discharge, discuss the process of performing non-invasive bilirubin checks on an infant after discharge, and discuss the procedure for documenting a non-invasive bilirubin check performed after newborn discharge. All right, Ms. Kay?
Why do we perform non-invasive bilirubin checks? Every newborn should be assessed prior to discharge for the risk of developing hyperbilirubinemia. If the level is borderline, the MD may choose to discharge the newborn with strict instructions and to return for a recheck. Transcutaneous bilirubin measurement offers a gentle, painless alternative to traditional jaundice screening. There's no blood draw, removing a major stress from babies and their parents. Which newborns need to return for a non-invasive bilirubin check? Newborns with borderline bilirubin levels, newborns with risk factors for developing hyperbilirubinemia. MD will give order for doctors that need to return for non-invasive bilirubin check.
Okay, so how do you order a non-invasive bilirubin check? And in your copy of the PDF or the PowerPoint, you can follow along with the screenshots. When entering the regular discharge order for newborns, you will click the option for return for bilirubin check. When this order is placed, it should page admissions and to create a pre-admission account so that that's already available when the baby is going to come back. From that drop-down menu, select when the infant should return for a check. Next, click OK and then submit the order. So when they come back, what's the process for performing the check? The first thing we do is the parents should bring the infant directly to Northwest. We should obtain non-invasive Billy tip and the meter from the nursery to use. Perform the non-invasive Billy check on the infant. After that's done, we need to notify the doctor of the level and document all findings under the pre-admit account. So how do you find the pre-admit account? What we need to do is open all scripts and select your Find Patient button, and you can follow along in your copy of your PowerPoint for step-by-step. Search for the infant by using its name as it appeared while in the nursery, such as Brewer, female. Next, you highlight the correct patient and click Show Visits. Then select the pre-admit visit and click OK. If for some reason there's not a pre-admit account, at this point we need to call admissions and have one created. It should be there, but sometimes it may not follow through like it's supposed to, but just make sure that we call them if it's not available. Next, we're going to go to our newborn treatment and carriage flow sheet. You're going to chart the infant's age and hours and the Billy reading in the appropriate spot. You don't have to calculate the age and hours. It will be listed on the top right hand of the screen. And just a reminder, be sure and page the doctor and notify them of what the bilirubin level is to see if they want any further testing. And if they do want further lab work, it can also be drawn under the same pre-admission account. That's all we have.
All right.
Thank you.